So the latest information that's come out is, the Advisory Committee on Immunization Practices just issued some new guidance late last night. So they are recommending that long-term care residents be moved into phase 1A, which is where the healthcare workers are as well. So as Texas, we have initially put healthcare workers as the phase 1A top priority. So we'll have to reconvene, and we're actually going to be meeting tomorrow to discuss whether or not we're going to change our phase 1A population. And additionally, we are working through the definitions for non-healthcare essential workers. And so, really talking through frontline workers that may be exposed through their job and day-to-day engagement with the community. We continue to look at our populations. So we estimate about 1.6 million healthcare workers in Texas that would be eligible to receive vaccine within the phase 1A. Now, we'll see whether or not the final allocations will actually, fit that within December. That's still up in the air. So right now, the timelines that CDC has is, early December 14th, 15th is when they plan to actually ship vaccine to the states. With the first vaccine that's coming out, we know it'll be Pfizer, so that will come directly from the Pfizer manufacturers to all the designated allocation sites. So, as a state and as the expert vaccine allocation panel, we make recommendations on which facilities should be getting those initial doses. And then when Dr. Hellerstadt, our commissioner, approves those, we'll be able to load that into CDC's system so that they will then ship the vaccine to our providers. Additionally, then CDC will send the saline and needles and syringes to the same sites as well, so that they'll receive dual packages of vaccine and ancillary supplies. So right now we have over 4,100 providers directly enrolled with us as the state. We have an additional about 2,400 sites that are part of the federal chain, so we're the Walgreens and CVS that those chain pharmacies that have also, so over 6,500 sites, unduplicated sites in Texas right now. So we do plan on having our first vaccine allocation sites to happen in occupational settings. So, the expert panel had recommended that hospitals be the top tier in order for us to receive the vaccine initially, because hospitals play such a key role in our community and we have to keep them up. So the first allocations will go to hospitals across the state in order to have them vaccinate their staff and their workers. As we get additional doses coming in, we will start allocating to additional providers across the state. That some of them will want to vaccinate their own, employees, and others are going to be opening up to vaccinate communities. And people that are other healthcare workers, but their employers may not be a COVID-19 vaccine provider. So vaccine is really best used as a prevention tool. It takes several weeks for it to fully kick in. Now, one of our guiding principles that the expert panel had submitted to Dr. Hellerstadt is to use the latest data across the state to help guide some of those allocations. So, right now, unfortunately, we have cases increasing all across the state. There isn't just one location in Texas. So, collectively, we are increasing our numbers. But it is important for us to look at the epidemiology of what's happening. But vaccine is best used as a prevention tool. Now, that doesn't mean that we are not going to be allocating vaccine to the hotspots. But we need to be mindful of thinking that vaccine is the silver bullet that is going to, magically fix the hotspot, overnight. Vaccines take a while to work. So we are going to have a site finder on our website that, will help people. We do, recommend that people call in advance to make sure that they still have vaccine available, within those clinic sites. And the other component is that, we really want to make sure this information is shared largely at the local level with, leaders within the community where we know they're going to go and ask for help anyway, and where they get that local information. And so we want to make sure that we're able to disseminate that really broadly. The fact that all of at least the two that are coming out right now require 2 doses is definitely going to be a more difficult task than what we had during H1N1. And so part of the initial kind of frontline factor to help with that is CDC will also be shipping kind of a shot record card that you get. And so many of us may remember, as a child, our shot records that will have the brand of the vaccine, the date that you received it, and the lot number, and then a tentative time of when you need to come back for the second one. So that's just for you as an individual. Now, providers are required to submit information on the doses administered on a daily basis. So that way, if you go somewhere else to another, you don't go to the same Walgreens, you go to another Walgreens, that they're able to look within our immunization registry and verify, because if I lost the card, my dog ate it, you want to make sure that you get correctly vaccinated. And so it's important that 2 doses have to be of the same brand. They are not interchangeable. The COVID-19 vaccine is completely voluntary. So we don't want anyone to think that it's mandatory in any way, shape, or form. Additionally, we're not going to be screening for residency status for those that are seeking vaccine. Now, it is important for us to have information to be able to follow up with the individual and remind them of, it's time for your second round dose, and this is the type that you need. So we do want to make sure that everyone that wants to be vaccinated seeks that out, and stays in close contact with their public health departments to make sure that they know what's the latest going on and where in their community they can have that information. All COVID-19 vaccine will be paid no charge for vaccination. So it is completely free. It is expected that whether you're insured, that your insurance company cover that. And if you're uninsured, you will not be charged anything. So we want to make sure that everyone that wants to get it gets it, and there are no barriers for that. So with the Moderna vaccine not requiring the ultra cold frozen, and so that's negative 80 degrees Celsius, so that's really, really cold. There's very few facilities, that naturally have that. So the Moderna only requiring refrigeration for 30 days is a game changer for the state. But not only within rural areas, because a lot of the current vaccinating community may not have that as well, even in urban settings. And so, we do want the Moderna vaccine to help ensure that we have widespread coverage where there may be limitations on the storage capacities. So we do anticipate Moderna will be available in the urban setting as well. It'll be a mix of both. We're really trying to leverage. We do expect probably more Moderna in the rural areas because of just the limitations of, the infrastructure that they may have. But we expect to see both all across the state. The message that I have is, cases continue to go up across the state. We're seeing, record hospitalizations across the state. People really need to do everything we can to stay safe and to help keep our numbers down. So wear a mask, when you go outside, wear a mask if you live, in a multi-generational household, and stay home when you can. We're only going to get through this together. And the longer that we are seeing these higher numbers, the worse it's going to be, and the more deaths that we potentially can see. So we need everyone to do their part and help us fight this so that it can be over.